Hey there guys, Brian Henny here, and in this video I'm going to be talking about, that's right, cancer. So, those of you who watch my introduction video know that cancer is a very personal topic to me because I had cancer. So I was born with a rare form of cancer known as bilateral retinoblastoma. I was diagnosed at 6 months. Uh, Bilateral retinoblastoma is cancer of the retina in both eyes. And for those that don't know, the retina is the part of your eye that, among other things, regulates light and those sorts of things. So we don't. It's hard to say exactly why I had it. It was genetic, but not hereditary. So it was a sporadic thing that I didn't get from my parents. They didn't have this genetic problem. They didn't have anything wrong with their eyes or any sort of history with this or any reason that it would have been passed down to me in any way. But anyway, to start with the beginning, I was born on November 15th, 1993, 8 minutes before my twin sister Paige. And one interesting thing about this is that had we been identical twins, obviously I don't think that uh, like different gender twins can be identical. So obviously we're not. But if we had been, I believe she definitely would have also had cancer. Fortunately, she didn't. That would have really been bad, because that would increase the chances that something would have gone wrong for one of us or more badly than what did happen. And it also would have been much harder on my parents having to deal with two kids with cancer. I think it must have been hard enough with one. So that's an interesting thing to consider with this. And then so basically, my mom noticed that there was something wrong with my eye. It would like go back and forth and stuff. There was just I don't know what all was wrong with it. Obviously, I wasn't really fully conscious. Like when you're 6 months old, you're not really cognizant of the things around you and everything. But my mom had noticed that there was something wrong. So when we went in for a 6 month checkup, my sister and I, when my mom took us in, they did like the eye checkup and everything, and what they're supposed to be checking it for is if the retina is attached to the eye, and apparently they didn't know that, I guess, or something. They didn't know what they were doing and said that they thought it was just a lazy eye. Luckily, although my mom doesn't usually question professionals that seem to be confident that it is just that it's not something else, in this case, she did, luckily. He wasn't a specialist in that field. He was just a pediatrician, but he should have known better than to say that it was just a lazy eye since he was supposed to be checking for if the retina was detached or not. And I don't know if he didn't or just didn't know what he was doing or what. So luckily, did go to a specialist, and they said it wasn't a lazy eye. They didn't say what it was, but they did recommend that we set up an appointment at Johns Hopkins, and that's what we did. A few days later, we went to Johns Hopkins and met Dr. Irene Momini at Johns Hopkins, who diagnosed me with bilateral retinoblastoma, and she worked with me with that, uh, both in the treatments I was getting for cancer as well as checkups after I had cancer for over 10 years after that. So what we started with was chemotherapy treatment, uh, which, for those of you who don't know, I think it's a fairly common thing that most people know about or at least have heard of. It's well, I guess I'll just start from the beginning on this. A little bit about the history of chemotherapy. It was discovered by Alfred Gilman and Louis Goodman in the 1940s, and they discovered that certain elements of nitrogen mustard agents could, basically, they saw that it could kill white blood cells, and they thought that that might be able to be used to can kill other types of cells, bad ones. And it was then used for taking out cancer cells, because what chemotherapy does is it's a drug that it focuses on rapidly dividing cells. So that also explains why people lose their hair, because your hair and those sorts of things are rapidly dividing follicles. So it kills off those cells as well, which is why people lose their hair. Interesting side note, the effects of nitrogen mustard agents on white blood cells that were observed by Gilman and Goodman are still seen in modern chemotherapy, as I know at least one time I had a white blood cell count of 0, and it's not uncommon for it does kill white blood cells also, along with the hair follicles, cancer cells, other things. But yes, I had a white blood cell count of 0 at one point. It's a very scary thing. I basically had to be quarantined because any small disease could turn into something much worse when you have basically no immune system. So the first 3 years or so, I had been going through different treatments of chemotherapy. I would go into remission for a little bit, and then I would get it back. And the way that it was administered was I actually had to get a port and a central line put in. They had to surgically implant it. I have permanent scars from that. I'm not going to show them in this video, but there's one here, and one there. This one's right here. That one's the biggest one. That's where they had to put in the port to administer the drugs because of worries that if they kept continuously injecting the drug into my veins, it could damage the veins, stuff like that. It could be more dangerous than putting in a port. So that's what they did. I don't know. I guess I was probably 6 months to a year when they put that in. So yeah, had treatments of that for about 3 years until, well, basically they didn't want to continue doing that because there is a certain point where chemotherapy becomes more dangerous, I guess. In other ways, they would rather not continue doing it for too long. I'd already been having basically continuous treatment of it for 3 years. So what we decided to do was my dad found out about this new treatment called conformal proton beam radiation therapy, and it was pretty new at the time. This was about 1997, I believe, and proton beam radiation therapy only existed. I believe the first time it was ever used was 1990, so this was really new. It was a bit of a prototype. Only 2 places in America had it: Boston and California. Loma Linda Children's Hospital, which is where I went because Boston wouldn't take me. Another interesting side note, and I'm not 100% sure about this, but as far as I know, I was actually the first person with retinoblastoma to get proton beam radiation treatment. So I mean, I said it was a prototype, but I believe I was the first one to ever have that. So I think that's pretty interesting. So yeah, that was our only option for doing it that way. Otherwise, we would have basically had to go with standard gamma radiation, and that's not as focused. It's more of just like a broad radiation that can do a lot more damage. For example, I would most likely be blind now, and I would almost certainly have had secondary cancer at this point in my life had we gone with that standard radiation. So we went with my dad found out about this conformal proton beam radiation therapy out in California. They did accept us. We were able to go out there for 6 months, and I got that treatment. A little bit about the proton radiation therapy. So radiation, I mean, first there was the X-ray, which was discovered by Wilhelm Conrad Röntgen in 1895, and later on it was found to be have use for combating cancer, and that's been a very common practice for combating cancer. Since then, it was still not very effective early on. I don't think it was until like the 20s or 30s that it was actually able to really be effective, and then chemotherapy became, in a lot of ways, a better way to go if you could cure it that way, because a lot of time you go into remission and then get it back. But early on, radiation therapy had to basically just be used as a secondary treatment, because they would basically just like try to cut out where the cancer was affecting early on. It was 100 years ago. It was not easy to deal with cancer. So we've had a lot of advancements since then, and This was new, like I said earlier, this conformal proton beam radiation therapy. The difference between that and standard radiation therapy is they use proton beams instead of X-rays. So it's much more focused and precise. So what they can do is they can focus a stronger field of radiation while not affecting, or at least not as much affecting the areas around it. So that's why, if you go with standard radiation, if I had gone with standard radiation, I would be likely to get something like skin cancer, bone cancer, even brain cancer, because they would be doing radiation on my eyes, and it affects things around it. So yeah, I was about 3. I was out in California doing that treatment for about 6 months. My dad went out there with me, and then my mom came out for the second half. He was out there with me for the first 3 months, and she was out there for the second 3 months. I was out there the whole time, obviously getting treatment, and it worked. It did work, at least at the time. So the belief based on the common treatments was that after 5, you were a lot less likely, or it really didn't generally come back after 5, based on what they knew. It's not. It's much more. It's a disease that affects younger children much more. The average age of people diagnosed with retinoblastoma is 2 years old. Obviously, I was diagnosed at 6 months. It's a little bit younger. Well, another interesting statistic about this is how rare it is. I said that it was a rare form of cancer. The interesting thing is that only about 2 to 300 people in the United States every year are born with this, which it out of the number of people that are born every year in the United States total is about, I think it was 1 out of every 20,000 people. So, that's not a lot. And then you factor in bilateral, which I didn't realize this until recently. 3/4 of cases of retinoblastoma are actually unilateral, meaning only in one eye. Mine was bilateral. That's only 1/4 of the time. So that means it's 4 times less likely. So really, it was only a 1 in 80,000 chance. I think that's so crazy, and really, sometimes it makes me think, it really sucks. Why, and especially since it's random, why am I the one that gets stuck with that? But other people have things a lot worse. I've been dealing with this my whole life. It's something that you just have to deal with, and you just have to accept things. And honestly, like, I'm used to it at this point. There's nothing you can do about it. You just have to accept the hand you're dealt with. So anyway, it was just, a bit of a fun statistic. Not fun, I guess, but just an interesting statistic about it. I didn't realize until recently how rare it really is. But as a little bit of the background of it, but like I was saying, uh, I was over 5. I made it past 5, and that was believed to be when it would be pretty much good. Didn't have to worry about it after that. But unfortunately, when I was 7 years old, I was re-diagnosed, and fortunately it was only in my left eye. So what they did was they just removed my left eye to just make sure they got rid of all the cancer. So it did. Luckily, I haven't had it since then. Actually, it'll be about a month from now. It'll be exactly 15 years since that I've been cancer free. So that's a very good thing. And I guess, knock on wood, I don't believe in superstition, but yeah, I guess that's pretty much it. Yeah, I guess I could talk a little bit about my experience of having my eye taken out. It was, I was under anesthesia during it, so I didn't have to experience that, luckily, because that would be pretty terrible. I can't imagine having to be awake for that. But afterwards, it was really, really disorienting. It was somewhat painful, but the biggest thing was disorienting. I remember I had to be wheeled out in a wheelchair afterward, and then I got in to our car in the parking lot, and then I just felt so bad, and I had to get out, and I just threw up in the parking lot because Like I don't know if you guys have ever had that where you feel the type of pain or disorientation that you throw up. I've only had it twice ever. There was that time, and then there was another time I had kidney stones, and that happened then. But it's it's different, you know. It's a weird experience. I also remember after getting home for the next at least week or so, I couldn't stand up on my own. I would need my mom to help get me. Like I would lay on the couch like all day, and I needed my mom to help pick me up so I could stand up and like help me walk. So that was, you know, it was really, there were some tough times, but uh, you know, it's like the butterfly effect. Everything happens, and there's nothing you can do about it now. It makes you who you are, and you know, I don't know what exactly I would be like had I not gone through all this, but I think it's an interesting thought. I just wanted to, you know, talk a little bit about that because it's such a big part of my life. Talk a little bit about cancer, and really just hope that people think about it every now and then. You know, I know sometimes we have these cancer awareness events and everything, but remember that for one thing, there are more than one type of cancer, and I'm not just talking about mine because mine is rare, and over 90% of people with retinoblastoma do survive. There are other effects of it than whether you survive or not, but the point I'm trying to make here is that there are many different types of cancer that affect many people, as well as other deadly diseases that directly impact many of us and at least indirectly impact most of us. And remember that those effects are not just felt 1 month out of the year or a few hours a day. Those effects are felt all of the day, every month of the year. And it doesn't mean you have to be constantly thinking about it, but just remember the people that are dealing with this. And I just hope that people will think about it more than 1 month out of the year, because from my experience, people seem to focus on one type of cancer 1 month out of the year, and I might do a video about why that frustrates me at some point. This video has already gone on too long, and I'm not going to do that. But I think, you know, I hope you guys learned something. I hope you guys think it's interesting, or even just that you know a little bit more about my background. So, anyway, let me know about, I guess, what you guys think about my background, my story, my experience with cancer, whether any of you have personal experiences with cancer, whether it's you yourself, especially if it's you yourself, because I'm definitely interested to hear other people who have had personal experience with the cancer, but also people that are close to you having that experience. Uh, and yeah, comment those, like, subscribe, and thanks for watching. I'll see you next time.